All right, we are gearing you up for surgery, and I want to make sure that you know exactly what to expect afterwards and what you need to be working on and focusing on. So, right after surgery, our primary goal is to get a happy knee. So, what I mean by a happy knee is we want to lower the swelling and inflammation as much as possible. We want to get back all your range of motion, primarily extension, which is when your knee is straight, and get your quad firing. So, in order to do all those things, the best thing we can focus on early is trying to get the swelling down. So the best things you can do is be kind to your knee and not put a lot of pressure and try and walk and push it too early. Okay. So you're going to spend a lot of your time working on elevating, icing, and compression. Those are the big things that are going to help push some fluid out of that knee. So your main resting position should be with your knee elevated higher than your heart. So if you're laying on your bed or laying on your back, you want to put some pillows down underneath your foot and ankle to elevate that knee higher than your heart. And I say put the pillows under foot and ankle because that helps keep your knee straight. If you prop the pillows back behind your knee, it allows your knee to bend, which might be a little bit more comfortable, but we really want to work on getting the knee straight early on. So we're going to put them down under your lower part of your leg, get that thing elevated above your heart, and spend most of your time in that position during your first day or two. And then during the first 2 weeks, you want to use this position frequently to be able to prop up, elevate, ice, keep some compression on it with an ACE bandage or with a compression sleeve. They'll usually give you one or two of those things when you have the surgery itself. One other thing that's going to help is getting you out of the immobilizer brace. Not all surgeons will give you one, but a lot of them will put you in an immobilizer brace after surgery if you've only had an ACL reconstruction or maybe even a meniscectomy where they go in and clean up your meniscus. We really don't need that brace, okay? And especially when you're just hanging out and resting, I want to get the brace off of you and allow that leg to breathe and be in a good, quiet position, okay? If you've had other things such as an MCL repair, anything involving some chondral defects or meniscus repairs that might require the brace by your surgeon's instructions, that's different, then talk to me about it. But otherwise, we can get you out of that brace whenever you're just hanging out and resting, and it's going to help to get that swelling down and get your mobility back early on.